Our mission here is to help our viewers, practitioners out there, to take better care of their patients, right? To really, when we talk to experts like you, it's our goal to share that information that you've built up over, was it 17 years in practice? So could you take us through the process that you use to diagnose, say, ADHD? I mean, that's the one that we're seeing so much of now. And then maybe after that, we can talk about how maybe that differs from autism, which I know is on a spectrum. But so what is your diagnostic process?
Maybe I'll back up a bit and just sort of talk about the conventional approach first. I think it's a bit more prudent. So with the conventional assessment and treatment of ADHD, there's no lab test. There's no definitive blood test, urine test, other test that says, yes, your child has this condition. Right. It's an objective analysis. It's done by a psychologist or a psychiatrist. It's a set of criteria. If you look at the criteria of ADHD, for example, most 5 and 6-year-old boys meet the criteria. Right. Hallmarks like excitability, inattentiveness, easily distracted. A lot of boys meet that criteria just on their own. Sure. And so with that, once the diagnosis is made, there may be recommendations for medication, which can have some unfortunate side effects sometimes, or they're getting assistance from aides at school, other behavioral therapies, physical therapies, speech therapies, those kinds of things. Just depends on sort of the degree to which they're affected. ASD, or autism spectrum, is more of a sliding scale. Usually with that, it's done at a younger age, usually done around age 3. And it's a more comprehensive diagnosis. With kids that are on the ASD spectrum, we're thinking about things like language delay, for example, loss of eye contact with the parents or their siblings, repetitive behaviors where they're rocking back and forth or lining up their toys or becoming fascinated with a spinning fan, for example, ritualistic behaviors where they like to do the same things at the same time. If you think of the movie Rain Man and Dustin Hoffman, he always liked to watch Judge Wapner at 5 o'clock in the afternoon, for example. Right. But it's also a sliding scale, and these kids can, go on to, self-injury or harm to others. So it can be, very much in society and sort of with the general fold, or be really significantly impaired. So it's both of the sort of ways to diagnose are similar but different.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel, and don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.